At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Springtime Allergies on Wednesday, April 15th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle, right here on WMAL 105.9 in the good old Washington metropolitan area. Got another great program for you today, one that is going to make you stop and think a little bit. It's going to make you stop and think about why you actually start breaking down and having all these weird symptoms, particularly kind of this time of the year. You know, it's beautiful outside, the skies are clear, things are working the way they're supposed to, things are budding out. The problem is that the sensitivities that you think that you have that are related directly to seasonal allergies may be much more than that. They may be something that's finger pointing towards something much more significant. And that's what I really want to talk to you about today. And don't forget, coming up this coming month, if you will, meaning in April, the 15th at the Roselle Center for Healing in Fairfax, Dr. Stephanie Pina, who's a doctor of naturopathic medicine, and I will be presenting tonight on springtime allergies, but more importantly on autoimmune conditions and how these supposed springtime allergies impact the inflammatory conditions that are associated with these things and make life a whole lot more miserable across the board. And you just think it's, well, the blossoms are out and things are springing and so forth. Maybe, but it has to do with the same thing. It has to do with your immune reactions. So let's get into the topic just a little bit. And by the way, I want to remind you that if you want to reach out and ask a very specific question, all you have to do is call the Roselle Center for Healing in Fairfax. I'll give you the phone number. It's 703-698-7117, 703-698-7117, and ask that have one of our doctors call you back. And they'll do a courtesy consultation, a brief consultation at absolutely no charge and answer your questions. You don't have any obligation. This is not a timeshare sales job, but they want to give you data and things that you can pursue straightforward and honestly. So you can do that. Call 703-698-7117. Let's get into the program just a little bit. Springtime allergies are related to autoimmune breakdown in your body. It means that your body's not defending you the way it's supposed to. So if spring is in the air, so are the allergens, right? But also the immune system is going to be challenged dramatically. So things like rheumatoid arthritis, psoriatic arthritis, lupus, Sjogren's, all of these things can be much, much worse during these springtime triggers that increase inflammation and dampen your immune reactions. And what happens is your autoimmune system is actually going overdrive and causing all these crazy things to start showing up. You start hurting all over the place, your head starts pounding, your joints are tight, you start breaking out all over your body. Understanding the connections between allergic reactions and autoimmune diseases is the key to reversing not only your springtime garbage that you're dealing with, but also these chronic, devastating, long-term conditions such as rheumatoid and psoriatic and lupus. It's important that you understand there's a distinction that you really have to get and you have to understand. So that's what we want to do today. We want to get into these just a little bit in depth and show you where the relationships are. Now, here's the deal. Springtime allergies are also known as seasonal allergic conditions, right? It can happen in the fall, not only in the spring. But the situation is very, very similar. The triggers are a little different. They occur when your immune system goes crazy and it overreacts. It goes into hyperdrive. And all these crazy things are out there. Your body's trying to defend you. What happens is you release these histaminic reactions, histamines, and these inflammatory cytokines. What is that like? Remember back in COVID when they started talking about interleukin 6? Well, you have an interleukin 1 and 2 and 10 and 8 and so forth. Some are short-lived and important for you, and some of them are devastating, like interleukin 6, which caused all kinds of devastation across the board. Now, which of these crazy things can increase overall inflammatory reactions in the body and get into a loop where other things begin to worsen and flare up, like your joint pain and the just wiped out fatigue patterns, inflammatory reactions. You can't think the way you're supposed to, that brain fog. The immune system begins to, start finger pointing. And I was doing that earlier, but you dumbed it down with all kinds of nose dopes and, steroids and things like that. But now you got an overload and it can't happen. So this increased inflammation dramatically exacerbates the joint pain. Your hands are stiff, your neck is sore, your low back is, screaming. That sciatica that you thought went away is coming back with a rage. And all these have to do with immunological reactions. So especially in conditions like rheumatoid and psoriatic arthritis and lupus conditions and Sjogren's and so forth, because we're hitting the guys that you all recognize, right? Immune system overload is something that happens when we suppress other types of symptoms over a period of years. The immune system is already misfiring, and it's causing these autoimmune processes to show up. Now, seasonal allergens and other triggering mechanisms make these other symptoms, these pain conditions, these I don't feel good conditions, my body's not working, my hormones have gone down the tubes, things like that. They're making these things worse. So fatigue and brain fog, right? What's that all about? Is it just that you're getting older, or do you really have a problem? No, these are histaminic reactions, histamines, and something called cytokines, which we mentioned a moment ago. It's your body's natural immune response to other things, but they contribute to chronic fatigue and brain fog and worsened autoimmune symptoms and so forth. Here's the deal. The medications that you go to the, over-the-counter stuff, you go and grab and say, let's see if this works, and you get hooked on it. The antihistamines, the decongestions and so forth, they're common treatments, but they further suppress your body's immune reactions. They suppress it. So now it reacts, and it goes up and it goes down. It goes up and it goes down. But pretty soon they don't work. And pretty soon your body's overwhelmed. And you go to the doc and, they tell you, well, you have this mast cell activation. Well, yeah, mast cells are things that kick in to help you, but they overreact. But it's not about fixing and suppressing it with a biologic, which everybody's wanting to use these days, but it's a matter of understanding the mechanism and then reversing the process. If you had repetitive injuries over a period of time, let's say you had a few car accidents and you're taking an NSAID, non-steroidal anti-inflammatory, to kind of keep it under control so you don't feel the pain, it drops the inflammation down. It's not fixing anything. It's artificially reacting in a way that your body now has to go deep. And the deeper it goes, it can't reset itself. Now, we're going to talk about that on the 15th and really make sense of that. But what if, I want you to think about this. What if you could control this thing and reverse it and get it so it was not there anymore? Was it something that you'd be interested in finding out about? Would it be something that you're willing to take the next step to do something about, even if it was in your own hands? I don't know about you, but my brain says, yeah, I think I'd want to know a little bit more about trying to fix this thing. So we're going to go through, we're going to give you tips to manage these crazy, not only springtime allergen reactions, but we're going to show you how to help yourself resolve, heal, put aside. A lot of the bowel problems that you have, the bloating, the distension, the cortisol storage, we're talking about a total imbalance in the microbiome and the ability of your bodies to digest things. That has part of what we're talking about. Why is that? Because depending on the author that you read, up to about 75% of your primary immune system is in your intestinal tract. It's the microbiome, it's digestive enzymes, in most cases have depleted over a period of time because you suppress them. How many of you have gone to your doctors and you complain about, I have a little bit of acid, and they put you on a suppressor? It's called a protein pump inhibitor. That means it suppresses your biological reaction of hydrochloric acid, gastrin, pepsin, and other digestive enzymes. Now you don't digest anything. You don't break anything down, even your foods. And if you can't do that, you can't absorb anything. And all the things that you need to protect yourself are no longer available to you because you've knocked out one of your primary elements. That acid that you're getting is usually one of two things. Believe it or not, it's either that you're getting too much pressure up against your diaphragm, so it's squeezing the upper portion of your stomach. So you don't fix it by putting a drug into it. You fix it by fixing the diaphragm and the nerves that go to it and the muscle reactions around it, and it goes away. Yes, it does go away, because I've got almost 5 decades of treating patients that will tell you clinically it goes away. The other piece is what? That acid that you think you have sometimes is a result of things not being acidic enough. You're saying, what are you talking about, Dr. Tom? You lost your mind? No, here's the deal. If anybody have ever played with a garden and you put too much lye on the garden burns out, right? So the same situation in your body. If you eat things that are way too alkaline, that are causing reactive patterns in your body, you're not getting enough acidity in your system. The same condition. And I know it's a hard concept, but I'll explain that to you in detail and what you can do to fix it. Sometimes getting just a little bit of apple cider vinegar and taking a couple tablespoons of it after you eat. You say, oh my God, that's going to burn. Well, not really, but you start with 1 tablespoon, a little bit in the morning on an empty stomach, and your body begins to dumb itself down, if you will. The alkalinity begins to balance out. It's an old, tried and true remedy that can be very specific and very good. So what would I do if you were my patient? How would I tell you, let's see what happens? The first thing that I would tell you is get rid of the junk, even before I tested you for anything. What am I talking about? Sugars and sodas and coffee and black teas and fast foods and fried foods and alcohol and gluten and additives and preservatives and GMO products. Wow, right? I just took away your entire diet. There's so many other things. We get stuck into a loop. But we want to be able to manage our health by ourselves, not artificially by putting medications into the system. So we've got to choose the right directions. There are things that are natural that'll drop down the inflammatory reactions in your joints. I think the last time we met with each other, I talked to you a little bit about quercetin. And if you put it in at high levels, that inflammation will drop down, but you're still not fixing the issue, because that gut may be the problem. That neurological system that's not working, that long nerve called the vagus nerve that comes from your brain and goes down and touches every organ system all the way through, that's causing them not to react or overreact, may be the issue. Now look, if that's the case, and I'm telling you that it can be resolved, wouldn't you want to know how that can happen? Join us on the 15th, and we'll make that a very, very clear point for you. So look, if you know you have rheumatoid arthritis, whether it's adult onset or juvenile rheumatoid, whether you have a Sjogren's pattern or lupus, where you have psoriatic arthritis, or you've got all these blotchy things that are occurring around your body. And by the way, if you had gone through this craziness over the last 6 years and you got sick and you had COVID and so forth, you may have high levels of what? Of parasitic infection in your body that is going to cause a lot of, that's right, I said parasites, and they have to be resolved, because otherwise it continues to beat you up and things become worse and worse over a period of many years. Look, the pain that you suffer, the springtime pain that all of a sudden shows up because you decided to go play a game of golf, or you went and you decided to play just a light game of, what? I'm not a tennis player, so it doesn't come up that easy. But you're out there and you don't seem to feel as gentle as you would like to. You're not moving as well as you should. Your muscles are too tight. Significant spikes in different autoimmune reactions in your body will cause a problem. Do you ever hear the spring fever injury type of thing? Well, when you take a few months off from intense physical activity, your body adapts to relaxing. Your tendons become less pliable. Your stabilizing muscles, the ones that hold the joint spaces together the way they should, lose some of their ability to withstand sudden movement and so forth. So when you suddenly demand those muscles, those ligaments to work quickly, particularly on an uneven surface, they suddenly let you know that they're not happy with you. One wrong step, even off the curb, that you misjudge the level, a mislanding on that tennis court, those ligaments can stretch or even tear, and now you got problems, right? So you got to do things that will help you prevent that, particularly if you know that your fight-flight system is not working the way it's supposed to. That's your adrenal system. That's the guy that produces your steroids. That's the guy that produces things that allow ligaments to hold tight. If your B12 and your folate levels are down, then your ligaments and your fascia are going to be at risk. So what can you do? The first thing you do is make sure that you got good footwear. Don't get cheap on your what you put on your feet. Shoes are important. If your running shoes or the walking shoes, most of us aren't runners, right? Matter of fact, I don't necessarily agree with everybody should be out running. You should be walking all the time. You should do HIIT training, which is walk slow, walk fast, walk slow, walk fast. Are in the back of your closet, check the bottom of it, check the tread marks on them. And, if you notice that they're worn, got to get rid of them. Most shoes shouldn't be around more than about 300 miles of use, 300 to 500 miles of use. Get rid of them so you can support yourself. That breakdown, that loss of integrity within the heel. And then make sure you go gently, pace yourself. This is a great time, to get your body into slow-mo and then begin to bring it up a little bit. So if you walked, 10 minutes a day, 15 minutes a day, you shouldn't try for an hour this week. Go slowly, gradually begin to build it up. Make sure you warm the joints up. What do I mean by that? Take a few minutes, and if you're not going to do anything, do some core training, get the blood circulation going, and then never stretch a cold muscle. Warm them up first. Do a little bit of Tai Chi, do a little bit of chair yoga, and then begin to move things around gently, and then go for a walk, and then do some other type of exercises. And you'll be amazed how you will resolve that pain pattern, or more importantly, stop it, if you will, before it comes around. I don't know about you, but good intentions often get us in trouble. We think that we're 20 years younger than we are, and then we go after ourselves. And when we do that, we think that we have the capacity to resolve, but we forgot that ongoing ache we have. We forgot those skin rashes that we've been putting up with. We forgot that we've had this head pressure for a long time, that we've been shoving things in our nose and dumbing it down with antihistamines and the like. If that's the case, don't fool yourself that you think you have the capacity. Can you get there? Absolutely. But do you have to identify the problem? Yes. You got to look first at the nervous system. Your nervous system is what? Your nervous system is the electrical system that runs your body. If it's been injured in any way, from a car accident, from a fall, from postural aberrations, meaning you're in the same posture day in and day out, and you never move away from that postural setting, you have an underlying something that's probably going to take you into a place of pain or not being able to recover. And so all of those ugly types of things. So, if you got wrist pain, why did it show up? You go to the doctor and say, well, you have carpal tunnel. Well, how did they diagnose the carpal tunnel? So remember that when your hand, you make a fist, you open it and close it. There are muscles and nerves that do that. When you just bend your wrist towards you, there are muscles and nerves that do that. When you try to turn your hand in a circular motion, there are 8 little bones in your wrist that allow you to do that comfortably if the nerves and the muscles are working the way they're supposed to, or if they haven't been misaligned. Now, you can have one of those 8 little bones out of place, but it's not a carpal tunnel. The carpal tunnel is a little trail, if you will, a little tunnel, a little groove in one of the bones in the center part of your wrist. And the nerve that goes through that is called the median or middle nerve, and it goes into your thumb and your index finger. Now, the rest of your fingers can hurt, but it's not a carpal tunnel. It's one of the other nerves and one of the other bones that take place. So you need to find out how to fix it without surgery, without paying somebody's car payment or their house payment, because they go in, they snip this covering around the wrist. It's called a retinaculum. And it's like a big heavy piece of saran wrap or plastic wrap. And they free up the bones, and it doesn't work long term. It feels good initially, it gets rid of the pain, but then you got a long rehab period to get it done. Wouldn't it be great just to get it back in alignment, fix the muscles that are associated with it? And way too often, the thing that is the primary mover that's missed is the fact that you have a pinched nerve in your neck or in your shoulder or in your elbow as it's going all the way down to the wrist, so the wrist can't fire. And if you come on the 15th, coming up in a couple of weeks, I'll show you what that really means. Just ask me the question. Say, you're talking about this craziness. So why is that important when we're talking about autoimmune conditions and springtime allergy reactions? Because your wrist has a bunch of ligaments and fascia that reacts to the fight-flight system, the adrenal system, that if it's not working the way it's supposed to, it's going to be more predisposed to little things that can cause major problems. So preventing these injuries has to do with finding out what the weaknesses are and what the problems are that may be predisposing you to all these things. So put it on your calendar. Come join me on the 15th. We're going to have some fun. Dr. Pina's brilliant. She's going to walk you through the platform and what it really looks like. We'll look at adrenal fight-flight. We'll look at intestinal tract. But if you have psoriatic arthritis, if you have Sjogren's, if you have lupus, if you have autoimmune degenerative conditions that suddenly now, this time of the year, are getting crazy. They're over the top. You're going to your doc, said, what am I going to do about this? And they start suggesting biologics. It's not okay, because now everything is going to get progressively worse, and it's affecting every system in your body across the board. Let's get to the core, the why behind this stuff. Let's fix it. Let's resolve the problem. And I'm telling you, after all these years, it's very resolvable, but you're in the driver's system. You're the one that has to make the decision that you're going to do what it takes to turn this thing around. And I'm telling you that it can be resolved. It can be turned around, providing that you're willing to do what it needs to do. And wouldn't it be great to get off the meds? Wouldn't it be great to get off the nose dope? Wouldn't it be great to have your life back? Wouldn't it be great to have some muscle tone in your body so you can do things without worrying about your back hurting, your legs hurting, your joint spaces hurting, your head feels like it's going to pop off the top? That's what I do. That's what these brilliant doctors that I happen to be blessed to be surrounded with at the Roselle Center do day in and day out. And the results that they get, people look at it and say, how did you do that? Well, we didn't do much. We just let your body do what it took to resolve itself. See, it's not about drugging it up. It's not about cutting it out. It's about putting yourself in a position that amazing creation called your body that was given to you will turn itself around the way it was designed to do. So join me on the 15th, 6 p.m. Now you got to call and register. You can go 703-698-7117 or go online at rosellecare.com. And by the way, if you're not doing it, you better do it. Follow me on social media, because I'm going to give you all kinds of data. We're going to let you know what's going on. We're going to teach you things that you can do to help yourself. We're coming up very quickly to the end of the program. Don't forget to check out our podcast on an ongoing basis, Ageless Health. To find it, you can go to drtomroselle.com and all the social media sites that we're on. So don't forget that. And remember, every Sunday, high noon, 12 p.m., here at the great old metropolitan area of Washington, D.C. I'm here with you. Remember, for one reason only, I love you all. You have a great Sunday. Take care. See you soon.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Springtime Allergies on Wednesday, April 15th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.